All right. Well, thank you. Welcome, everyone. I hope everyone is doing well. Hope you had a great long holiday weekend. And we're getting towards, I don't want to say the end of the pandemic, but things are looking positive, let's say that. And with that, as more people get vaccinated and infection rates start to decrease, we all are starting to think about getting back to work or school, or for those of you who we've been working straight through the pandemic, we may be transitioning back to going into work instead of working from home. And so we talked a little bit before about separation anxiety, and we're going to talk a little bit about that again, and just really look at ways to help lessen the blow, if you will, lessen the stress and the anxiety on our pets. Both cats and dogs can get separation anxiety. I'm going to focus more on dogs, but wanted everyone to know that, as you know, many of us, I included, have adopted pets throughout the pandemic. This may be the first time that we're going away, and even just for a couple of hours, for a day's worth of work. So we have to get them all accustomed to our absences. So first of all, I would love to thank Assisi Animal Health for continuing to provide these awesome webbies. I think it's phenomenal that a company steps up and educates pet owners, veterinary healthcare team members, really the entire veterinary healthcare team, of which pet owners and shelters and technicians and veterinarians, we're all a part of that team. So thank you to Assisi for doing that, as well as for allowing me to speak to you all and talk about some of the topics that are of interest in helping to provide the best life possible for our pets. So we know that dogs are social animals, and by nature, they prefer the company of people or animals to solitude. Even dogs that appear independent, right? They spend hours napping in maybe a different bedroom, or they still are basing that independence on the fact that they know their owners aren't far away. And as many of us know, there's a world of difference between dogs who wander to a quiet spot in the house and those who are left alone for hours as we start to go back to work, back to school, and even start to increase our participation in social activities. So separation anxiety is the clinical diagnosis applied to a variety of behavioral issues. And these issues have one thing in common, that the dog feels or is left behind by its human. And we know that this anxiety can present in a number of different ways with a whole host, a big range of intensities. So what are some of the signs? I think you guys know this. A few of us over the course of the past year during Webbies have talked about separation anxiety. And we know that affected dogs might exhibit their distress by destructive chewing and digging, right? We know that one. Maybe urinating and defecating in the house where they've never done that before. Both cats and dogs will vocalize when they are anxious. Licking their paws or areas on their body that causes fur loss or raw skin. And this also, has to be vetted, if you will, because licking over certain joints is a symptom of pain. So we have to definitely get our veterinary healthcare team involved to make sure that we're addressing the right thing. So we also know that separation anxiety can result in chewing or having items in our house ruined. Refusing treats, right? If you have a dog that loves treats and has stopped taking those from you, then we know that that is a clear signal that something is wrong. It could be that they are extremely anxious. So like you see in this bottom picture, right? Wide eyes with that furrowed brow and dilated pupils. The ears are down, right? And to the side or even back a little bit. They start pacing. And then sometimes they will even just shake, not like shiver in place, but more like when a dog gets wet and they do the full body shake. That also is a sign of anxiety. So another thing that we haven't talked about before is that dogs and cats can pick up on human behaviors and stressors. So if we're stressed, right? Now, for instance, I'm going to a conference at the end of the week. It's the first time in well over a year that I've traveled, and I used to travel a great deal. And so I'm sure that I am giving off some, anxiety because it's the first time and, don't really know what to expect. So I'm sure that my dogs are picking up on some stress. We also know that the past year and a half has been extremely tough. Owners are struggling. And yes, pets are affected because, again, they're picking up on those behaviors. A lot of pet owners, right? A lot of us are experiencing dramatic increases in our own anxiety and depression. And all of these things impact pet health and happiness. So what we need to remember is that destructive behaviors are not retaliatory behaviors. They're not retaliating because, they're home and we have to go to work or we have to go to school or we're going, out to run errands. Part of the reasoning, though, for that is because the objects that are commonly damaged are personal items. And those personal items belong to us as the owner and carry our scent. So think about books or clothing or shoes or even the sofa cushions that we sit on. So contact with these items may serve to remind the pet of the absent owner, which causes anxiety that triggers destructive displacement behaviors. And as I mentioned, our routine is changing or is likely going to change if it hasn't already. And that can trigger separation anxiety in dogs and cats. So the dogs or cats that may not have had separation anxiety or distress may actually start to develop it, and certainly with our now going back to work or our change in routine can also exacerbate separation anxiety in dogs and cats that already have it. So we really need to help our pets manage separation anxiety. And really what it takes is a simplified program with proper homecoming and departures. And what we're trying to do is teach relaxed independence away from the owners. So we're getting them to be more calm when we as the owners are away. Decoupling departure cues from actual departures in combination with drug therapy, which we're not really going to talk about here, but we know that medications are a part of the whole multimodal approach to separation anxiety management. By decoupling those departure cues from actual departures, we are working to improve most problems. There are, as I mentioned, it's a multimodal approach. There's a number of different ways, right? We talked about combining the decoupling departures with drug therapy, and there's also targeted pulse electromagnetic field therapy, which we'll talk about as well. You know that as the Calmer Canine device from Sissy Animal Health. So we should be creating a safe haven, okay? If the dog is barrier anxious and digging, chewing, or scratching its way through their distress, then we need to find a dog-proof area, such as maybe the kitchen or a mudroom or maybe a spare bedroom. Hopefully, this safe haven is a space where the dog on its own chooses to sleep at times. And what we should be doing is getting a gate that's securely bolted, easily opened for this safe haven. And it's best, as you can see here, this type of a gate where, okay, it's pretty secure on this door frame. It's also see-through because many dogs panic when they're faced with a shut door. As I said, our veterinarians are probably going to help us by initiating drug therapy, and really that's an important part, again, of the multimodal management, because dogs with anxiety are stressed. Many times they're traumatized with an impaired ability to learn new tasks, right? They're so anxious they can't focus on learning. So behavior modification is absolutely effective in treating separation anxiety. But what we want to do is get some anxiolytics on board so that can help facilitate treatment and reduce anxiety more than training or management changes alone. Drug therapy is commonly used to assist with behavior modification, and it's both humane and it has proven helpful. So we really need to come up with a baseline for our pets that are suffering from separation anxiety. And so, we should be, instead of doing this when, we're back to work, our first, 8-hour or whatever day back in the office, or at least not working from home, we need to come up with this baseline ahead of time. So maybe, go out for a little bit, run some errands, and then, have a videotape running, because we want to get that baseline for panting and pacing, urination, whining, barking, digging, right? We want to see those signs that the pet is exhibiting, as well as their timing. How long does it go on for? When does it start after the owner leaves, as well as their intensity. Video camera can be aimed at areas where elimination or destructiveness has occurred, and really recording 30 to 6 minutes is going to give us a pretty good idea of the dog's distress immediately after departure. If barking is the main complaint, then audio taping will suffice. Video or audio taping should be repeated as we start the multimodal approach to management, so we can see how things are progressing. And then some people like to journal, and it's a great way to mark elimination behaviors outdoors, as well as when the owner or one of us leaves the house and returns. If we're able to help the pet with managing their attachment, then that is certainly going to help the process move along or progress at a much more reasonable, much faster rate, faster. Because dogs that can adapt to being separated when the owners are home are less likely to tolerate the owner's actual departures, right? That makes sense. So we're trying to encourage independence from the owners. So we can provide a mat, and here we go, and an open crate, right? Or our safe haven room, where attention is offered only when the dog is calmly sitting or lying down in that area. And then that area can be used when the owner actually departs. Also, to help with this process, we want to give the pets, or give the dogs in this instance, a food dispensing toy. We want to, it's a diversion tactic, right? So it's going to distract and help counter condition. So when we as the pet owners are leaving, the dogs see that they have a toy. They have a toy with something that they really enjoy, which is food. And it's taking away from that, oh my gosh, my owner has left and I'm just going to, I'm just going to destroy the place. Anxious dogs benefit when fed food from these food dispensing toys. As you see here, there's a number of different ones. You can even do homemade ones. Because again, the toy is distracting and counter conditioning. It's redirecting that dog's attention to something pleasant during an unpleasant time. What we also have to remember is that food dispensing toys should be offered at other times as well. So they're not associating that food dispensing toy with a stressful event, and then the toy becomes a trigger. We also want to habituate to cues of departure. So again, we're talking about that concept, that psychological concept of desensitization, because desensitization has been proven in humans and dogs and horses. I mean, it's one of the tenets of psychology, and it's definitely one of the tenets of training animals. So it can be helpful for dogs that become reactive at the moment of departure. So say you as the owner are just walking up to the door, right? Then perhaps the dog is really starting to stress at that point. And then you try to open it or even walk out. So we have to desensitize to those behaviors. And so typically the veterinarian has had them on an anxiolytic drug for about a month or so. And the dog has learned to manipulate the food dispensing toys in their safe havens. And it's around that time, once, been on meds, getting used to the safe haven and their food dispensing toys, that's when we want to start the desensitization. And really, it's a technique that introduces repeated exposure or habituation to those departure clues. So we want to start with maybe picking up keys, right? Because guarantee you, the dogs hear those keys and they start to stress. Maybe turning off lights or even putting on a coat. These departure exercises are a huge component of separation anxiety treatment. And by habituating to these cues, the process is going to help disassociate those cues from actual departures. And again, we're going to talk about targeted pulsed electromagnetic field therapy, but it's all part, again, of this multimodal approach to managing separation anxiety. So we want to, again, desensitize, having repeated exposure, and getting the dog used to these departure cues that we've already talked about. And again, it's going to help them disassociate. And then to truly have a psychological or a behavior win, we have to then change things up. We have to change the ritual, because then they'll become sensitized to the ritual, right? So in addition to helping the dog disassociate departure cues from actual departures, then, as I mentioned, we have to change things up. Maybe having the owner leave through a different door, or put their coat on in the garage, or maybe even park down the street. Once the dog has responded well to simulated departures and changes in these departure cues, then we can work on desensitization to true departures. And so at first, again, what we're doing is very gradual. I'm talking about it very quickly, but it's a gradual process, and you will have a team in place to help you. If you present to your veterinary hospital, the healthcare team there is going to help with this. So at first, departure should be brief, and the owner shouldn't leave. The door can be approached, touched, opened slightly, and then closed. The duration of departure should be determined by those videotapes that we took. So if the owner leaves for 5 minutes, but the dog is calm for only 3, then 5 minutes is too long, and the time has to be shortened, because what we're trying to do is reward the dog for positive behaviors. And depending on the dog's tolerance, the first actual departure may last from a few seconds to a few minutes. It's important to realize that breaks in the dog's calm behavior. So maybe they were sitting or they were down, and then they rise or they approach the door anxiously, they start to vocalize. That's giving us the knowledge that desensitization session has gone too quickly. And we have to end the session after a few successful but shorter departures. And then again, it's all gradual. In subsequent sessions, the dog then can participate in less challenging exercises that prove successful and the dog can successfully tolerate. We're trying to build success, especially for the dog, but also for the owner and the healthcare team. So, sorry, I got so excited talking, I didn't keep up with my slides. So this we already talked about. Here you see this guy starting to vocalize. So that's a break in their calm behavior. So the session went too quickly. The most important thing is that we're ending our sessions after successful shorter departures. And this one rings true for me. Minimize the difference between owner presence and absence. So to decrease the impact of owner departures, we should not change noise levels. So if you typically have a television on, right? I don't have the television on, all day long. But if I leave and my dogs are in their crates, then I turn the TV on for them. So they have some noise. We keep the lights the same, and gates. Because what we're trying to do is also minimize owner-dog interactions, while leaving and returning. So if my dogs are in their crates, then they're not going to know exactly when we leave, or at least they're not going to be there. They can hear better than any of us, and they know when the door shuts. And they also know when we return, but they're not right there to jump on us, right? They're in their safe haven. And again, white noise machines are also wonderful. You heard that I leave the TV on, but there's also, radios, whatever works for you, as long as it's providing some type of white noise and decreasing the impact of our departures. So it's going to help muffle outside noises and provide background sound. And dogs really like classical music, and some like talk radio because they hear individuals talking. What we want to do at all times is avoid punishment. So we're going to work with our owners to avoid punishing for anxiety-related behavior, because by definition, punishment is unpleasant or aversive. So, regardless of what the dog's behaviors are doing, including chewing or barking, all of those are behaviors manifesting themselves because of distress. if the owner, if we arrive home and it's associated with punishment, or the owner suddenly opens the door to shout at or maybe discipline the dog, that anxiety can certainly worsen. The guilty look that many of us have described indicates that classical conditioning has occurred. So now what I mean by that is the dog now associates the presence of urine, feces, or destroyed items with the owner's arrival and with punishment. And so typically, if that's the case, then that behavior will recur the next time we leave. So reprimanding the dog for bad behavior hours after the behavior takes place does nothing to prevent the behavior from happening again in the future. So we need to really focus on enriching their environment as well. Pets thrive, right, with play and exercise and mental stimulation. And when those needs are not met, dogs as well as cats can act out or can, experience separation anxiety. So we need to ensure the home environment is meeting the needs of the pets. So one of the main things that we want to try to do to prevent anxiety would be to try to make sure that the home environment is meeting those needs. And think of this as prevention for separation and anxiety. And so what are some of those? Again, play, exercise, and mental stimulation. You can see these two here are playing with a rope toy with a Kong on the end of it. And this guy's just running around. It's another beautiful dog with a toy in his mouth, right? He's happy. He's running. He's probably hurting something in that shot. When pets have enough engagement at home, they're going to be happier overall. And granted, it will be different from breed to breed, right? Because here you have a type of terrier who is playing with this ball with their owner. That's great mental stimulation and engagement, right? Pets that get plenty of exercise and entertainment use up their energy in healthy ways before we leave. A bored pet is more likely to seek out extra attention with unwanted behaviors. You've heard me say this before, and I will say it again: exercise. Frequent exercise sessions have a calming effect. They decrease anxiety and provide suitable social interaction. This is true of dogs and humans, right? So aerobic exercise 2 to 3 times a day can have a very positive effect in many cases, because it's producing those feel-good hormones, right? The serotonin, the dopamine, and the endorphins. Okay, so which brings us next to Calmer Canine. And I'm sure you guys know, or at least have heard about Calmer Canine. And it's a highly innovative, gentle, effective, safe, and drug-free treatment system for separation anxiety. It delivers targeted pulsed electromagnetic field therapy signals to the area of the brain responsible for causing those symptoms of anxiety. Imagine, that's why I love this product, because of it signals the area of the brain without drugs, without having to cut. It's electromagnetic therapy, which is pretty amazing to me. And it helps return the anxious brain to a more balanced emotional state. And yes, I mentioned a number of other modalities in there, but what this is it's a multimodal tool. So I've talked about multimodal therapy with canine separation anxiety this whole half hour. This is another wonderful tool to help with that. Because as the fight or flight center, the amygdala is the area in the brain that's responsible for producing those fear and emotional responses, which express themselves as the signs and symptoms of anxiety. So an anxious brain, as I mentioned, is out of balance with overactive brain cells that are producing harmful substances causing inflammation and cell death instead of beneficial substances that reduce inflammation and protect the cells. So Calmer Canine works at the cellular level and sends targeted, pulsed electromagnetic field signals to the brain to increase the production of nitric oxide, which helps to reduce inflammation. And it also causes those neural cells, those cells in the nervous system, to produce those feel-good substances that we already talked about. Okay, the serotonin, the dopamine, and the endorphins. So this is just going to show you that you can also have a vest that holds the device in the proper position over the dog's head during treatment. So here's looking very handsome in his vest. And here's the Calmer Canine. And typically what is recommended is 2 15-minute treatments every day for about 4 to 6 weeks. And what has been found is that it reduces signs of canine separation anxiety with lasting effects. So again, significantly reduces the signs. The most important thing, and this is what we're going for, we're improving, or Calmer Canine helps to improve the quality of life for that anxious pet. And it has long-lasting results. Now, Calmer Canine also helps with other anxieties. So think of your noise phobias, etc. It's well tolerated. There's no sensations to, freak the dog out. It's very gentle. It's effective as both a standalone therapy or as part of that multimodal approach to managing canine separation anxiety. So to prevent separation anxiety, we should be discussing similar situations in the future that might trigger a recurrence and how to best avoid problems. So if we think that there's going to be a significant alteration in your schedule or the amount of time spent with your dog, then the changeover should be made as gradually as possible. Okay, so remember, dogs are social animals, and by nature, they prefer the company of people and animals to solitude. Separation anxiety is a clinical diagnosis with a variety of behavior issues, which we talked about, but the main one is that the dog is feeling left behind by its human. By managing separation anxiety, we're rebuilding that human-animal bond, but it will take a great deal of patience on all of our parts. So we mentioned desensitization, medication, targeted pulse electromagnetic field therapy, food dispensing toys, and safe havens. So there are many approaches to help as we start to go back to work and our dogs and cats have to get, accustomed to that. It takes a great deal of patience. So thank you.